Hi everyone, I believe you're all doing fine. In my previous video, I mentioned the fact that I'll be inviting some of my colleagues to speak on some health matters and health issues. And the last time we heard from Nurse Babatunde, today we need another person, Nurse Okoye. She works in the labor. Please do sit back as she has a lot of things to say to the pregnant women, especially the first timer. Do stay back, enjoy yourself, note your questions, note areas where you need clarification, and I'm very sure she'll be willing to attend to all your questions. Thank
My name is Okoye Chamak, a registered nurse in Alimaso General Hospital, working in labor ward. We're about to discuss what labor is all about, especially to those ones that are first timers that doesn't really know about labor. So we'll discuss what labor is all about to enlighten you more. Especially most of us are afraid of labor or pregnancy, so that we know it's not a kind of a dangerous affair to venture into. Labor is all about painful contraction. It's painful, yes, painful uterine contraction that's accompanied with dilatation of the cervix, that is opening of the mouth of the womb. For a first timer, it might take longer to up to 16 hours, but sometimes we give some injections that can help to reduce the pain and reduce the timing too. And also it also depends on the body system, that this other person's own last for up to that 16 hours doesn't mean that the second person's own will last up to that 16 hours. We've had cases of patients that last up less than 4 or 5 hours. We call it precipitated labor, that the labor will not last for too long. Before you know what is happening, the patient have delivered. So labor is painful, and the dilatation of the cervix is gradual. It's not like a fast thing that will just happen immediately you go into labor. No, it goes gradual before you get into full dilatation. So you will start from opening of the cervix 2 cm, then we'll get to 10 cm before we will be able to tell the patient it's time to bear down. So when it's time for you to bear down, there are a lot of things we expect from you as a mother when you are in labor. For instance, when you are in labor, we expect you to do breathing exercise, breathing in and out, a kind of trying to blow candle, just trying to blow it out. It doesn't stop the pain, but it will help you to reduce the urge to bear down, especially when the patient have gotten up to 8 cm dilated. From 8 cm, 9 cm dilated, there will be strong urge to bear down. But when you are using this respiratory breathing exercise, it will reduce that urge to bear down. We expect the mothers to open their mouth, blow candle during the labor. We also expect you not to struggle too much or shout too much, because none of this can reduce the pain, but it can only make the mother to be weak. We always encourage mothers to reserve their strength, because when they enter into the second stage of labor, we need all the strength for the mother to be able to bear down and bring forth the baby. Then we have stages of labor. The first stage of labor, it starts from 4 cm. That's when we will define that a patient is actively in labor. From 4 cm to 10 cm, that's when it ends. Then we'll enter into the second stage of labor. That is when the patient is 10 cm fully dilated, the cervix is fully dilated, the baby is ready to come out. And at that stage, I also expect you as the mother to still cooperate with the midwife, because your cooperation with the midwife or the birth attendant attending to you increases the rate of survival. In terms of labor, we are battling not only for the mother, we are battling for the life of the mother and that of the child. So at that stage, when we take you into the delivery suite, we encourage you to open your legs, hold your ankle, and spread out your legs and bear down. A lot of liquor, a lot of things inside the vaginal wall that baby can be sucking in if the baby is allowed to stay there for long. So we always encourage the mothers at that stage, at least 2 to 3 pushing, and the baby is out, so that the baby will be able to cry at birth. Then the third stage of labor, which is the stage where the placenta is delivered. After the delivery of the baby, delivery is not completed. so till the placenta is delivered. At that stage, you don't have much to do. It's just for you to relax, allow the midwife attending to you to gradually deliver the placenta through CCT, that is control cord traction. Then the person will evaluate you whether you're bleeding or not, and clean up and assess whether there is any cervical laceration or vaginal laceration, or if you've been giving tear. In some cases, especially first timers, we always give what we call episiotomy cuts to help the baby come out, because in first timers the vaginal wall is still very tight. It might not allow the baby to pass through. So most times we cut the person, we call it episiotomy. We cut the person to allow the baby to come out. Then the final stage, which is the transitional stage. In this stage, after delivering of the placenta, that's when this stage comes into place. That is the first 1 to 2 hours that we allow the woman to rest in the delivery suite after delivery. This helps us to monitor the woman's vital signs, that is the BP, the temperature, the pulse rate, to see if there is any changes, because some women is after this stage that they will start bleeding. This stage is also very important to us. We monitor the patient, we give medications to help the patient not to bleed throughout the period. Thank you.
Wow, what an insightful presentation. Thank you so much, Nurse Okoye. So it's question time. If you have any question, please do drop it in the comment section. Thank you.